Hi, I'm Ruby Bryant. I'm Director of Student Health Services here at Randolph College. I'm also a member of the Coronavirus Task Force, which is a subgroup of our Critical Incident Management team here on campus. The Coronavirus Task Force has been meeting since mid-March to be able to bring our students safely back to campus during this global pandemic. Some of the questions that people ask are, what is the task force doing to help prepare for our students to safely return? And I can tell you, this is the hardest working group of people I've ever worked with, including any hospital that I've worked in over the past 20 plus years. We are doing it all for our students who are the reason that we're here at all, for the love of our students and our campus community at large. We have worked with our local healthcare system, Centra Health. I work with the Department of Health in Virginia, local, state, federal health officials, CDC. We're following all guidelines set forth by the CDC and the Virginia Department of Health. We meet with the Virginia Department of Health with some other colleges and universities every Friday to establish guidelines and protocols. Of course, the wash your hands, wear a mask, and practice social distancing or physical distancing are key to keeping this pandemic, this virus at bay. And we are hoping that all of our preparations are going to be shown in a very successful spring semester. We have marked distance in the dining hall, in the classrooms, anywhere on campus. There's signage talking about wearing your mask, washing your hands, all of the safety precautions that we have put into place. We have been working on throughout the summer and fall to prepare for our students to come back. I think that our city, our community, our healthcare system, our local healthcare system, I meet with them on Tuesdays every week. And, right now their capacity is not in question. They are able to handle whatever is happening right now during the surge. But we are always, in touch with them. We would never want to overwhelm our community at large. So we are always listening to what they've got going on, and we have a really good working relationship with our local healthcare system, as well as many other colleges and universities. We meet regularly to discuss best practices and protocols, what's worked, what hasn't worked, and what we should do. And we have learned so much from our other colleges and universities in Virginia and throughout the United States that we've been speaking with. The health center, we are stocked up on our personal protective equipment, which has taken most of our budget this year. We have gloves and masks and face shields and gowns and all of the protective equipment and that we would need to be able to safely care for our students. We will be testing on campus, which was nothing close to what we would have been able to do in the fall. I think our testing capabilities have increased dramatically. We are waiting now to hear from one of our distributors to be able to buy plenty of tests for our students for the spring. We will be doing symptomatic testing. If any student is ill, we will be testing them here right on campus. They won't be having to go off campus to look for somewhere to give them a test. We will be doing random surveillance testing of the campus, students and employees both weekly. We will do that on campus as well. We're hoping to set up a tent in the parking lot to safely do that outside where there's great ventilation, safer for the person testing and the people that are being tested. The health center will also be doing a lot of education, virtual education, telehealth services. The counseling center will be offering telehealth services as well as in-person sessions, depending on what the students need and want. So we are prepared. Our staff is prepared. I think that virtually we are we feel pretty comfortable now seeing students via a computer screen. But of course, in person is the best as far as health is concerned. So we're prepared to do that as well, safely, with plenty of protective equipment for everyone. I think the buildings and ground staff have done an incredible job of keeping our high traffic areas clean. There is a protocol for bathrooms, dorms, the health center, how often things are being cleaned and disinfected to prevent the spread of this virus as well. Our B&G staff have been doing this since March and have just done an incredible job with employees on campus. So we're, grateful to them as well. The Wildcat Wellness Council, it's our peer health educators. They have been working all fall to do virtual programming, and we think that will be one of our main sources of information for our students in the spring will be virtual programming, how to be healthy, how to maintain your mental health during this crazy time that nobody has ever experienced before. In our country anyway, during our students' lives, during our lives. But it's really important for our mental health as well as our physical health, and to be in touch with people. So our Wildcat Wellness Council will be working probably on our Wellness Wednesdays. We'll have virtual programming, and we just can't wait to be able to do everything in person. So once the vaccine is available, hopefully we will encourage people to get the vaccine so that we can all be back together again behind the red brick wall. Thank you.